Okay, you're all being recorded, just to let you know. Um, So we still don't have a rep for the strategic planning process. So the last one that we did was 2019, that we developed together just as we were in the process of merging. And right now we are looking to do that again. For the next 2 to 3 years, we're trying to develop a strategic plan. We're working with a different professional. We're working with a guy, David, who is a former hospital administrator down in Glens Falls, I believe it was. And is now retired and does this on the side. I was involved with them at Life Plan. I'm on the board of Life Plan, so I thought he did a great job with them. I think he'll give us a different perspective. So we have a small strategic planning group that's made up of a couple of board members, a few directors. I want some 2 EAC reps, and we also have our 2 self-advocates that are on that. And basically what we're going to be doing is working with David to get an idea of how to develop some things. We want to do focus groups with certain groups of people. One of them being community members, community leaders, self-advocates, and our staff. We want to develop a survey like we did the last time to go out to get some ideas on what people are thinking. Then from that, we will then have another group that'll be made up of the strategic planning group plus the full board, and then a few directors. And then after that group works on some objectives, we will then look at fine tuning it with a larger group like we did last time. That'll be across the agency representation, parents, self-advocates, DSPs, other staff positions, probably 25 to 30 people. Some of the things we're looking at strategically is we're looking at really having not as many objectives and looking more at the issues that we're facing and the broader issues, and then how we can overcome some of those. The field's in flux right now. There's a lot of new models of service being looked at. We're just getting out of COVID. So we want to develop a plan that'll lead us into the next 2 to 3 years as we prepare for those paradigm switches. So looking for someone, it's not going to be a huge time commitment. We're only talking, and most of it's going to be Teams or Zoom. There will be some face-to-face that'll be done. But really would like a rep from this EAC to be on that group, if someone's willing to do so. And we were not going to end the meeting until someone volunteers before we're done, just to let you know.
I would do it, Howie.
Okay, so Mike Burley's going to do it. All right, I'll keep you abreast of. Actually, I'll email you. We got a meeting on Friday.
Okay.
I'll send you that link. Not a lot of information on EFMAP, other than they're still looking to release the funds by the end of the month to our accounts. That doesn't mean that's automatically going to be a check written to staff, because there's a large amount of background information that has to be done to make sure people are being paid correctly based on the definitions of the attestation. So we do have 90 days from the time we receive the money to pay it out for the COVID payment for the first round, the vaccine incentive, and the longevity. And then for the retention, we have up to 180 days. We don't plan to take that long, but and I know that accounting, they have so much going on right now with our accounting software implementation, our CFR being done, all the survey stuff that keeps coming in. So you just got to be patient. We'll work on it and try to get it done as quick as possible. I am looking, I'm going to be meeting with Jill to see if we can hire a consultant possibly to take some of that information that we need out of our payroll systems. So that's all we've got for that right now. The $5 and $10 Stewart's gift cards that we put in place to go along with pride certificates, or people could be nominated just for them. And up here in St. Lawrence, Those cards are maintained in residential with Tammy Styles. All you have to do is go down and say, I want a card for so-and-so, and you sign off for it. It's been utilized very little. The $10 cards have been used up here, but there's still 78 of the $5 cards left. I am gonna order some more to restock. But people just haven't used those. But you can either give them without a prize certificate, or if you have somebody that's gone really above and beyond, you can add a $5 or a $10 card to a prize certificate also. And then, as I've looked at before, I am going to put into the 2 stores, goal stores in Ogdensburg and downtown here. We wanted another avenue for people to convert their either prize certificates or their coins for. And I think it's timely that they be gas cards. So I'm going to put Stewart's cards down there, $10, $15, and $20 cards. People can then turn their tokens in or their prize certificates in to get those. Just an update on the budget. The budget still looks fairly favorable, even after the 30-day amendments. There's still the 5.4% COLA that's in there. And that's, for all Medicaid dollars. It's not that we'd give not everybody's going to get a 5.4% increase in pay. That's the amount of money we're going to get to divvy out towards pay. So some of it will be going towards increasing base, but we have not received trends hardly at all in the last 10 years. So there's other things that some of that money is going to be used for. We've only got 1.2% in the last 10 years. So health insurance has gone up, our contribution, workman's comp, energy, all those things. So that's still in there. The 11% for our preschool program, the trend is in there, which is very favorable in Jefferson. And then there still is the $3,000 bonus for all direct line workers. I think the definition is a little more than just DSPs, but I haven't seen the exact language there yet. And that's over a 2-year period. You can apply for it in 6-month increments up to a maximum of $3,000. And I know that the care coordination organizations are advocating for that to become permanent pay instead of a one-shot deal. But that's still in the budget also. Let me just pull up one more thing I've got here. Oops, I don't want that on PowerPoint. Okay, so there's money in there too for minimum wage increases. Really doesn't impact us hardly at all. Only a few positions in some of our contracts. There's a money in the budget to hire a Office of Chief Disability Officer. That's going to be with the governor's office, and it's basically to address employment. There's also some nonprofit infrastructure money available, but it doesn't reference DD providers at this time. So we're advocating for that. That would help us with some physical plants. There's money in there for crisis intervention, the use of telephonic service, and expanding telehealth. There's also supportive decision-making. So right now there's guardianship, but there are people that don't need guardianship. They just need someone to kind of guide them. So there's this what's called supportive decision-making. They assign someone to assist them in making decisions. The Arc of New York does support it, but they also want people to realize that guardianship is still essential for a certain group of people. There is direct support professional credential pilot being put in place possibly. And they're also is talk about putting in there a $5,000 tax credit for direct line workers. So when you do for your taxes. And then the 30-day amendments. So to be eligible for that $3,000 bonus, the eligibility was at 40 hours. They knocked it down to 35 because some agencies, 35 is a full-time employee. Well, they moved the most a person could make up to 125,000 versus 100,000. And that's basically it for that. Okay. There you go. Our wheelchair vans, 3 of them have come in. The 4th one, they couldn't get started, a brand new vehicle. So they're trying to resolve that. But we have the 3 vans. I've been working with Christine Lozon on where they're going. First, we are going to require that staff be trained on them, both from driving, they're a little bit different, as well as training on strapping people in the wheelchairs before we issue those. Those are the vans that we ordered last spring. The other vehicles, wheelchair vans for 2022 budget have also been ordered, and those should be coming in the next couple months because they're in stock. 2 more are coming up here to St. Lawrence and 3 in Jefferson. Or excuse me, 2 in Jefferson and 2 wheelchair vans and 1 adaptive van for St. Lawrence. And then we are also getting 5 Toyota vans, and those are in the process of being ordered right now and should be delivered in the next several months. And a maintenance truck here and a maintenance truck in Jefferson. So we went in purchasing those together with the 2 other chapters up north to save money. Also, we've been fairly successful in getting some bus drivers. The next bus driver is going to be hired is going to be for to from. So that's going to help us with our, bringing people into Dayhab that hasn't been done yet. Dayhab right now is about 63% capacity compared to pre-COVID. So we have to really work on getting our numbers up here in St. Lawrence. I'm meeting with FEMA again tomorrow to put another application in for PPE and sanitation supplies. See if we can get some more money. And staffing, our applications are fairly consistent, but they're going up, been kind of up and down, but we're getting people hired and starting to, I think our vacancy rate went down 3%. I think it went from 25 to 22 here in St. Lawrence. So people are coming in. There's a group of 5 in ONT right now here. We're happy about that. The only impact on our bottom line, our income statements, is we're doing okay, but with the downturn in the market, our investment income is part of our net income when we do our income statements every month. And last month we lost $1 million, and this month I'm sure it'll be about the same. So that reflects as a negative in our budget, even though it's outside money. And then, we are in implementation with NetSuite. NetSuite's our accounting software, so both counties are now using the same accounting software. We'll probably do a dual with our old software for a little while, but at least we're all on the same chart of accounts and moving forward. And a lot of work's been done on that. So I'm sure there'll be some trials and errors, but it'll be great to have everything on the same format. And like I told you guys before, once we get into it and start doing income statements, you're going to be able to see your program specific data as well as the agency. And that's all I've got. You guys have any questions? Betty, are you on?
I have a question pertaining to me. I don't even know who I'm supposed to call. I got a thing from the agency's insurance company. One of my staff hit my husband's truck with one of the vans. It was just a scratch on the bumper. I didn't put a claim in, so I don't understand why they sent me a thing. Because if I put a claim in, it's going to cost me $500 just you know what I mean? It was just a little scratch. So who do I talk to about that? I didn't even put a claim in. I don't even know how the claim went in.
Well, we reported the accident, so they're considering a liability. So that's why they're reaching out.
So yeah, okay. So I just talk to the insurance company and say everything's fine, or
If that's
okay.
what you want to do, but I mean,
Yeah, it's just
you can get it fixed.
there's more damage to the van than, because it's a big, huge truck, and yeah, you can't even see the scratch. So you
Okay.
can see the dent in the van, but
Yeah, you got to respond to the insurance company, Philadelphia.
okay.
Yeah, they're just contacting you because we reported it. Anything else? Okay, when's your next meeting going to be? You guys want to have a joint meeting at some point again with Jefferson? So, okay, so next meeting will be April 12th. And Michael, I'll forward you the meeting for strategics.
Do you approximately know what time?
Yep, I can tell you exactly. 1 second. It's at 2
Howie, we
o'clock.
were talking.
2 o'clock, Michael.
Okay, that works. Thank you.
What?
We were talking on a residence manager meeting about having a big cookout for the individuals and stuff.
Yeah, I mean, I think we'll see how things go. Things are getting better. You know, we haven't had.
Maybe this,
Yeah. Are we
if
looking
we
into
could
it?
get, there was one residence manager said she could get, I guess her husband works for Michael's, that they putting all the power things up. She said she could get them to donate stuff if we did it.
Yeah, I
If
mean,
we had a big cookout.
yep. We'll just have to wait and see how what happens with COVID, but things are starting to get better. So I think we can, you know, in the spring or early summer, we can probably look at doing something like that. If things hold constant.
So if it got better, could we do something?
Yeah.
Okay.
Well, the other thing I wanted to just mention to the houses, so the tablets that you have that we got from the NCI grant, either of those, or one of the things that people we support are asking for is to be able to talk to each other. So if you can make arrangements to hook up with another site that people want to just chat, that's been asked by multiple people here in St. Lawrence, that when they do the town halls, they like to chat back and forth. And they said they'd like to do that more. So that'll be a way that, so that NCI grant that purchased all the tablets for residential. It purchased laptops for all the nurses and did some tablets for the behavioral group also. And then we got permission to buy 7 more laptops for the larger sites in Jefferson because one's not enough. So we're being asked to do a video. So Michelle Quinnell is going to be putting together a video related to some of the objectives that we used the grant for. One of them was, reducing the number of miles that nurses have to travel. They do the one visit a week, and then they can interact in between via the tablet or laptop. More thorough review of objectives in relation to diabetes and all a variety of things. But there are currently quite a few objectives that we're just going to demonstrate how we've had better outcomes as a result, and do that through the video. We have to submit that by the end of April. And then a quarterly report has to go in also by the end of April on our progress on the grant. So we ended up getting about $34,000 through that grant. But it's been fairly good, other than we have issues up here in St. Lawrence with connectivity in some locations. Anything else? Okay. You guys have a good rest of your week. There's my.
Have a good day, everybody.
Have a good day.